Good afternoon. My name is Kim Bittner, and I'm with the ESRD National Coordinating Center. Thank you for joining us today for the ESRD NCC Patient Education Webinar event. The ESRD NCC webinar events are held in partnership with the Centers for Medicare and Medicaid Services. The calls feature patient and professional subject matter experts from around the country sharing how they or their organization are coping with situations related to COVID-19. Before we get started, I wanted to let you know that this call is being recorded and will be posted on the NCC COVID webpage, usually within 3 business days. Many times we will have the recording up on the webpage well before that. Let's take a look at the agenda for today's call. Today, we are pleased to have Dr. Elizabeth Christofferson, who is an assistant professor in the Departments of Psychiatry and Pediatrics at University of Colorado School of Medicine and a licensed clinical psychologist at Children's Hospital Colorado. Our topic for today is celebrating the holidays safely during COVID-19. So what is this call all about? You will hear tips to empower yourself to cope with COVID-19. We will share some real-world experiences that you can put to use. We have some resources for you to use and share with others. And then this series of calls is available to you bi-monthly, offering a variety of topics. Before we get started with this presentation, we wanted to share a new resource with you. And if I can have the next slide, there we go. This resource, Tips to Help You Boost Your Physical and Mental Health During COVID-19, was developed by patients for patients and offers 10 practical tips for coping in this environment. You can find this resource and others at www.kidneycovidinfocenter.com and then click on the For Patients tab. This webpage offers a variety of information, including handouts, webinars, videos, and links to trustworthy organizations. Let's begin our presentation. As Dr. Christofferson goes through our presentation and you have questions, please submit the questions using the chat feature through WebEx or the Q&A, which is on the lower right of your screen. When we get to the question and answer section of this presentation, we will share those questions that we received with Dr. Christofferson. And our goal is to answer as many questions as time allows. At this time, I'd like to introduce you to Dr. Elizabeth Christofferson. As we introduced previously, Dr. Christofferson is an assistant professor in the Departments of Psychiatry and Pediatrics at University of Colorado School of Medicine and is also a licensed clinical psychologist at Children's Hospital Colorado. She is the clinical director of solid organ transplant psychology and kidney center psychology at Children's Hospital Colorado. Her clinical work focuses on patients with kidney, liver, and heart transplants, as well as ESRD patients and their families. Her research focuses on adherence, health disparities, substance abuse, and risk and resilience factors related to health outcomes. Welcome, Dr. Christofferson. We are pleased to have you here with us today.
Thank you so much for that introduction, and thank you all for joining today. We'll be discussing the upcoming holidays and how to celebrate safely. We can go to the next slide and the next one. Wonderful. So just to start with some context, we know that there are so many stressors already present for everyone, and COVID-19 adds stress in these domains listed here. We all have potential stressors in terms of physical health, medical needs and safety, mental health, emotional well-being, family, social, school or work. And even prior to the pandemic, these may have been present for you. Of course, the pandemic adds to this. We know that having a chronic illness adds a significant component of stress that those without a chronic illness do not experience. And this is especially true in the pandemic. So knowing that, certain patients are higher risk for infection for COVID-19. We know the complication risk is higher for dialysis patients, for infants, patients with chronic kidney disease, or transplant patients. And on the one hand, some of you might feel like you've sort of been prepared for this and have always lived in a mode of heightened awareness regarding illnesses or infections and your medical health. And for some of you, you've already practiced different types of isolation or social distancing even before the pandemic. But on the other hand, you may be even more aware and concerned about the risks of COVID-19 because of this. Next slide. We've really been weathering this pandemic storm now for a long time, about 8 months, and we're all really feeling tired of it. The stress of getting COVID-19, isolation and restrictions and changes to your daily life. It's also, of course, an election year, with today being the big day. So thank you for being here and listening in during this time. And I know this adds additional stress to our news cycle and minds. People are really feeling the effects of loneliness, lack of connection to loved ones, missing travel to see loved ones, and missing spending time with others in an easier way. And on top of all of this, we now have the holidays, which usually can be a time of joy, but also can cause stress, even in a non-pandemic year. As we know that holidays add the stress of planning and organizing, getting presents for people and food. We know family gatherings can always be a source of stress and joy. And this year, that is even more so the case when we're trying to figure out how to celebrate safely and might be feeling some sadness around not having our typical holidays. So really my goal today is to help reduce stress so we can enjoy the holidays, however we decide is the best and safe way to do so. Next slide. So I really want to stress that the impact of the pandemic on mental health has been really concerning already, and we don't want holiday stress to worsen that. A Center for Disease Control study found that the following in terms of elevated mental health conditions during the pandemic. These are disproportionately worse among younger adults, racial and ethnic minorities, essential workers, and unpaid adult caregivers. You can see the rates here in this diagram, this graphic, that in late June this year, 40% of adults reported struggling with mental health or substance use, and the prevalence of anxiety disorder symptoms was 3 times higher than a year before in 2019. Depressive disorder being 4 times higher than in 2019, which is really profound. While considering the mental health impact of the pandemic, which is really fueled by all the changes, anxiety about the pandemic, isolation, we also need to pay close attention to the physical health risks of the pandemic. And holiday decision-making is kind of about weighing these different risks very carefully. Next slide. So it's important to know your own risk level based on your health and the appropriate guidelines based on this. So people over age 65 and those with the conditions listed here are at higher risk for severe illness and complications due to COVID-19. And this is based on evidence already collected and determined throughout the course of the pandemic. There are additional conditions that also might be higher risk, so evidence is still being gathered, and those are listed on the CDC website as well. So how do we navigate some of these risks, especially if you have one of these conditions listed, and how do we try to stay safe? Next slide. We know there's some things that we can all do to mitigate anxiety regarding health risks and to lessen the impact of risks on our mental and physical health and well-being. And this is always important during the pandemic and especially in the context of any holiday gathering. First, let's discuss some of these basic tips. These will help you feel more in control and reduce anxiety by ensuring that you're following precautions and have what you need to be safe, whether in relation to the holidays or in general. So we know basic hygiene for illness, staying home if you're sick, covering coughs and sneezes with a tissue and throwing it away, washing your hands frequently, especially before eating food, touching your face, using restrooms, caring for sick people. You want to make sure to be following social distancing guidelines, staying 6 feet apart from people who are not from your own household, following that guideline indoors and outdoors, wearing a face covering or mask in public when you're out of your home, cleaning surfaces frequently, especially those high-touch surfaces, monitoring any symptoms that may appear for you, and even actually wearing eye protection in public has recently been shown to reduce the risk of COVID-19. Next slide. For patients with chronic kidney disease specifically, there are some additional guidelines from the CDC, and those include, of course, continuing your medications and diet that has been already prescribed, making sure that you continue your treatment, including dialysis and your medications, having, a supply of prescriptions on hand. If you can get more than 30 days, a 90-day supply, that's always helpful. Keeping enough food to follow your diet and knowing that you want to have certain foods on hand based on the emergency diet plan for kidney disease, maintaining your fluid and diet restrictions, staying in really good contact with your healthcare team, especially if you do have any symptoms that arise, and avoiding crowded places, condensing any errands or trips out of the home, and utilizing online services for delivery when possible. Next slide. So there are current concerns based on, the rise of infections right now during this sort of third peak or spike of COVID-19. We know Dr. Fauci, director of National Institute of Allergy and Infectious Disease, has really encouraged people to think carefully about how they spend the holidays to avoid, further increases in rates of COVID-19. We also know that the winter forces us more indoors, and indoor gatherings do contribute to the spread of COVID-19. And overall, people at increased risk should avoid in-person gatherings with people who don't live in your own household, and definitely should avoid larger gatherings and consider lower risk activities instead. So really the following guidelines that I'll discuss should be taken while also considering that you may fall into that high-risk category, and weighing the risk and benefits for you is really important, as well as consulting with your own healthcare team specifically. Next slide. Again, decisions during the COVID-19 pandemic regarding any activities are about this weighing of risks and benefits. You may have the health risk to yourself, and this should really take a large priority in your mind. There are also public health guidelines that you need to consider and follow any guidelines or state and local orders in place. You'll also want to think, though, about your mental health. If it is suffering from lack of social connection, how can you engage in social connections safely, and what risks are worth that? What are you comfortable with, and what's most important to you in the context of these risks? These are some things to start thinking about. Again, consulting with your healthcare team with your specific questions, and know that any guidance in this presentation is informational in nature rather than medical advice. Each person really has their own individual aspects of their health to weigh with their healthcare team. Next slide. So I'd like to walk through sort of a risk assessment decision-making tool with steps that can help you determine whether an event feels safe to you. The first step is really assessing the rates of COVID-19 in your community and the community that you're considering a holiday or gathering event in, or potentially where people who might gather together are coming from. So you can find helpful tools and rates of COVID-19 on the CDC website and also the local area public health department website. you can really see the exact rates in different counties across the nation. Once you've kind of looked at what are the rates currently and what does that mean in terms of risk, you want to assess actually the location of a potential holiday gathering. So we know indoor gatherings are higher risk than outdoor gatherings. Knowing that poor ventilation is a factor for higher, ability for the virus to be transmitted. And if you're able to be outdoors, there's less of that risk. Indoor gatherings with really good ventilation, open windows and doors can be helpful if it does have to be indoors. The next step would be assessing the number of people gathering. So the more people, the higher risk, of course. Keep in mind that people, including yourself, who are in the high-risk health category, how many people are there in that category, the comfort level. And in some states and areas, there are currently regulations on the number of households that can gather. For example, here in Denver, Colorado, it's 2 households at any given time are sort of allowed to be together. Can you, safely distance with that 6 feet apart rule with the number of people that you're considering having gathered, and how might that work logistically is another thing to consider. Next slide. So next, think about where the attendees are coming from. So mixing people from multiple locations and places is not recommended, especially if some of those people are in really high-risk areas in terms of the COVID-19 rates. In terms of the type of travel, there are varying levels of risk associated with all types of travel. So if travel is a factor, we'll talk about that in a minute, and in terms of where people are staying. You then want to think about what are the people who might attend this gathering? What have they been doing before the gathering? What kind of behavior are they engaged in? How many people are they coming into contact with on a day-to-day basis? Are people able to agree to quarantine before a gathering for 1 to 2 weeks, or is that not possible for them? Do the people who might attend a holiday gathering tend to follow those basic precautions we talked about during their daily life, such as mask wearing? And then you want to think about the behavior during the gathering. So here in step 6, are you all able to engage in mask wearing, social distancing, hand washing, and kind of not sharing food? Those are all things that can lower the risk. Next slide. And in terms of the travel component, the risks of various types of travel vary, and you can think about what precautions are possible if you or family or friends are traveling. So for plane travel, you'd want to try to avoid public transportation to and from the airport, knowing that, of course, you're going to be on that airplane, but if you can avoid it at other times. Staying away from crowds in the airport, sanitizing everything at your seat on the plane, keeping your mask on during the flight. I know they've said trying to get a window seat so you don't have lots of people walking by you in the aisle is helpful. For any kind of car or driving travel, you'd want to make sure that your car is ready for the drive, in good working condition. If you can, pack your food and drinks so you don't have to stop for those. When you need to stop, whether it's for gas or a restroom, making sure you sanitize and wash your hands if you're touching any surfaces in public and wearing your mask. For staying at hotels or vacation rentals, whether it's you or family or friends, you really want to know the safety protocols that establishment is taking ahead of time, and make sure that you feel comfortable that they're taking really good precautions. It can be helpful to keep windows open upon arrival, just to keep airing out that room, cleaning high-touch surfaces when you get there. keeping your mask on in any public area of a lodging space. And then if you have, family or friends staying with you or you're staying with them, you'd want to think about, is it possible for us to get tested for COVID-19 before we come together, and is it possible to quarantine? Make sure you're comfortable with any precautions that those people are also taking. Next slide. And then in thinking about things to make sure during a celebration or travel, again, following these basic precautions if you do decide to gather with people or travel, being careful with social distancing and mask wearing, limiting contact with surfaces, washing hands, and really encouraging people to bring their own food and drinks. This is probably not the time to do, your potluck or buffet style food. It's a time where, people might bring their own food or make sure that things are not being served in a way that everybody is touching and serving their own food. And knowing that still means you can enjoy your food, but in a more safe way. Next slide. So I wanted to give some examples, and these are really from the CDC website, of lower risk ideas, lower risk activities for the holidays. So some of these lower risk potential, Thanksgiving or holiday activities would be things like having a small dinner with people in your own house, preparing meals and delivering them to family or friends or neighbors in a kind of no contact way, so dropping them off for them is a really nice way to share your food and recipes. Doing a virtual dinner with loved ones where you are still sharing a meal together, but virtually. Shopping online rather than going in person during those really crowded days like Black Friday is a way to, still get those great deals and sales, but in a safe way. And, watching sports events or parades or movies from home rather than going out to those events. Next slide. For some sort of what we consider moderate or medium risk activities, you could think about a small outdoor dinner with family and a few friends who live in your community. And there are some additional recommendations on the CDC website for how to host sort of those outdoor gatherings or cookouts outdoors. And that can be helpful to look at if you're thinking about that. Visiting an outdoor place where precautions are in place, so a pumpkin patch, an apple orchard, where people are using hand sanitizer before touching those things, where wearing masks is enforced and people can sort of maintain social distancing. Attending a small outdoor sports event where there are precautions in place also could be considered sort of moderate risk. Next slide. And then some example of what are considered higher risk activities. So again, going shopping in crowded stores around Thanksgiving time, being at a crowded sports event or parade as a spectator, using alcohol or drugs, to the point of where it can cloud your judgment and increase risky behaviors. We know that reducing our inhibitions is not something that we want to do during the pandemic, where then we might forget some of those precautions that we should be taking. Attending a large indoor gathering with people from outside your household, that is kind of definitely a higher risk activity where you're indoors and you have other households and other people gathered together. And then traveling, the risks vary based on how you're doing that travel, of course. Next slide. So I just want to give some basic tips and tools for decision making, which apply to deciding how to safely celebrate the holidays, but also apply to any other weighty decisions in your life. We know that writing out a pro and con list can be really helpful. Writing helps us process information. Seeing and reviewing those pros and cons can help you make a decision on how you want to handle the holidays. Some of the factors in your list, in your pro and con list, might count more than the other factors, and so that's something to think about too. Another tip is to kind of pretend you've decided on how you want to celebrate the holidays and sleep on it or sit with it for a few days and notice how you feel. Do you feel relieved or anxious or some of both? And all of that might be normal. Are you feeling regretful? Are you wishing you decided differently? That can all give you clues into kind of what your gut tells you and what you're comfortable with. You can also gather information from your specific healthcare team, of course, trusted friends and family, and those involved in the potential celebration. So discuss with them how to celebrate safely and what they think. And also know you can change your mind at any point, even close to the time of the event. Next slide. So it's also helpful to plan for some of the thoughts and feelings that may arise as we're thinking about the holidays coming up, even once you've decided your plan. Knowing there are many considerations, it's important to think about how to cope with the plan that you decide on. Knowing anxiety might linger even after determining your plan and during the event and after the event. So write a list of concerns and how you will address them. What is your strategy and plan? Write down your plan and talk it through with the people who are involved in it, who are part of the gathering. Respect other people's opinions and decisions, even if they differ from your own. Base your decisions on what you're comfortable with. While you can ask others to follow certain rules or precautions, you really can only truly control your own behavior. So knowing this can help you make the best decision for you. And then having a script for how to inform others of your decision can be really helpful in preparing for what you want to, inform them of, regardless of which way it's going to go for you. But if you feel like you're going to be disappointing someone, if you do decide you can't engage in certain activities, these are some statements that can be helpful in terms of, informing others of what you've decided and kind of having firm, direct, honest conversations. So there's little room for guilt or follow-up questions. So, finding a way to compromise and finding a way to celebrate safely while also letting them know that you have your own plan and idea about what works for you. Next slide. So this is a really great time to be creative and resilient in our holiday planning. So we can take this opportunity to enjoy some new activities, start new traditions, modify older ones, take time for self-care and relaxation, and take some pressure off the holiday gatherings. So for example, you can still have that virtual dinner. Maybe you all make the same dish, but eat it virtually, separately together, open presents together virtually. You could have each family member, including the kids, participate in cooking, make a new dish, or have each person kind of cook one of your classic holiday dishes. Start new traditions with activities that are exciting and new and maybe feel more safe to you. Watch a new movie that can be your traditional holiday movie, go on a family walk somewhere new, play a new board game. Enjoy having a smaller gathering. So we know that means less prep, less mess, less cleaning, and really less stress in a lot of ways. You can look at, family pictures and videos from your past holidays and reminisce and get excited for the next time we can kind of come together in a more typical year for holidays. Next slide. And after the celebration, again, we know we may have emotions around the holidays, which can be true any year, but especially this year. You may experience anxiety if you did engage in some risk-taking, or you may have disappointment that you didn't get to do your normal holiday activities. These are all normal feelings. It's good to acknowledge them, talk about them, and engage in coping strategies to move forward. Think ahead about these emotions. Which feels more acceptable to you? Would you rather experience some of that anxiety around risk-taking so that you can see some of your friends and family, or the potential disappointment of being more cautious and celebrating in a different way? We can still have gratitude, which we know is protective and beneficial for our mental health based on whatever celebration we were able to engage in. And engage in mindfulness about your holidays. Notice what you missed and what you ended up enjoying more about this way of celebrating. Next slide. And this is really a reminder to continue to engage in all the important coping strategies that are always helpful, and even more so during the pandemic and holiday stress. So overall, one way to reduce anxiety is monitoring your media. News can be both important to stay informed, but also a source of stress and anxiety. If news is causing you stress, limit that news and media consumption. Limit it to 30 minutes or less per day. Turn off news alerts on your devices, and utilize trustworthy news and medical sources. Monitor your screen time. We know it's likely increased right now. Some screen time activities make you feel good and connected to others, and some can make you feel exhausted or anxious. Between Zoom, video calls, virtual work meetings and learning, social media, news, which of those make you feel good? And knowing that some of them are necessary at this time, but you can set healthy boundaries around them. This is also a really important time to establish and maintain a daily routine. Despite our routines being disrupted, especially with the holidays, we know consistent sleep-wake cycle, having daylight in the morning, and overall exercise and stress management continue to be important. This can increase our immunity and regulate circadian rhythms. So make sure to get your 8 hours of sleep a night. Discontinue electronics before bed. Make sure your bedroom really promotes sleep and is quiet, dark, cool, and relaxing. And monitor, caffeine and alcohol and your diet overall. Even just getting dressed during the day is really a cue for you that it's time to start the day and can be helpful. And despite gyms being closed, or maybe you don't want to be in a gym at this time, there are many ways to continue to engage in exercise, either indoors at home or outside if it's warm enough, and practiced in a safe, socially distanced manner. There are lots of free apps with trainer-led workouts, and it's important also to take breaks between time at your computer or sitting. Our bodies really need these physiological breaks to stretch and walk around. Next slide. So we know that stress and anxiety really create tension, both in the body and the mind. And when we're stressed, we tend to have tense muscles. When we're in fight or flight mode, we tend to tense up. So utilizing relaxation strategies really helps reduce tension in the mind and the body. Some of these include deep breathing, guided imagery, progressive muscle relaxation. These are mindfulness-based stress reduction techniques. They're evidence-based and scientifically shown to reduce stress, anxiety, and depression. They can even help with pain management. You might feel like these are sort of hokey, but I really encourage you to try these practices if you haven't yet. And we know we can all benefit from this during the time of COVID-19. Many of the apps listed here are free currently, and really great ways to just start with some deep breathing or mindfulness activities. You can also do simple mindfulness exercises like taking a walk, exercising, other forms of relaxation, self-care, like watching movies, cooking, cleaning can be healing for some people, doing arts and crafts, other soothing activities. Or maybe you just want to take advantage of some time to refocus and calm yourself with some alone time. Engaging in your hobbies, so keeping your hands busy with tasks. This can also reduce anxiety through behavioral activation, coping, and distraction. So things like knitting, cooking, drawing or art, doing puzzles, painting your nails, writing lists, journaling, all of these can be helpful to people. Of course, continue to connect with your friends and family virtually. Keep in mind, even virtual social connections like FaceTime or Zoom can feel tiring at times, so don't judge yourself for this. Be mindful of whether you're isolating or withdrawing socially and find a good balance for you. Utilize different forms of technology or some of those older methods of communication too. So whether it's video calls, texts, phone calls, letters, or some of that physically distanced outdoor social connection. Next slide. I want to highlight a few additional tools. So positive psychology refers to kind of positive psychological resources, such as having positive affect, smiling, laughing, life satisfaction, overall happiness. We know we can really work to increase this, and these are some strategies that help with that. So 3 good things is a gratitude practice that has scientific evidence. Every day for 7 days, you write down or record in this app called 3 Good Things. You write down 3 good things that happened that day and your role in bringing them about. And this has shown to increase happiness and decrease depression symptoms. It has an impact even after that first week of completing the exercise. Another strategy that's been shown to be helpful is doing random acts of kindness. This actually promotes well-being in the person doing the act of kindness even more than the receiver. You can practice giving back to your community, being a helper. All of this promotes well-being in yourself. The goal here is to define your core values and embrace them. In terms of values clarification, the best is when your values across work, relationships, and leisure overlap. So this is really protective against burnout when you're kind of living your values in the different domains of life. And then resilience is like a muscle. It's not fixed. It can grow stronger over time. We can all grow in our knowledge about ourselves and each other and learn from this time during COVID. Next slide. And finally, I'd like to review this really helpful model for coping presented by Russ Harris, who's the author of The Happiness Trap. And there's actually a really nice kind of little mini graphic video online for this as well, and an ebook. And these are the steps here just briefly. So focus on what's in your control. So we can't control, what happens with COVID-19 or the economy or the future, what others do, but we know that fear and anxiety might be inevitable, but you can control your own actions here and now. Acknowledge your thoughts and feelings. Notice what's going on. What are you feeling and thinking, such as I'm having feelings of loneliness. And then coming back into your own body, connect with your body. So this is that mindfulness, deep breathing, being aware of how your own body and mind are feeling. E is for engaging in what you're doing. This means focusing on here and now. So refocus your attention on whatever activity is at hand. One practice for this is noticing 5 things you can see, hear, touch, taste, and smell around you. That's a very mindfulness-based practice, giving your full attention to the present moment. C is for committed action, so really implementing effective action that's guided by your core values while following the guidelines of, the pandemic. Asking yourself, what can I do right now that improves life for myself, those in my community, or my family and friends? O means opening up. So make room for difficult feelings and really be kind to yourself. Acknowledge fear, anxiety, sadness, loneliness that we might be feeling. We know we can't stop these feelings, but we can make room for them, normalize them, and treat ourselves kindly. What can you say to yourself? What kinds of things can you do for yourself in those moments? And then values refer to your core values that guide your committed action from the C step above. What do you want to stand for during the COVID-19 pandemic? What sort of person do you want to be? Examples of these values include love, respect, patience, caring, courage, compassion. So sprinkle those values into your day and help them guide your actions. I is for identifying resources. So gather your resources for help, assistance, support, and advice. And of course, we know there are many great resources for mental health, crisis hotlines, and additional websites that you can find through the CDC. Finally, disinfect and distance. Continue to practice physical distancing and good hygiene. Remind yourself what you're already doing to remain healthy and how you already have a lot of skills to maintain your health and prevent infection. And remember to use these various coping skills throughout the holiday season, however you plan to celebrate. Thank you all for joining. I really hope this has helped you thinking about the holidays, and I'd love to open it up for some questions.
Thank you very much, Dr. Christofferson. That was a very thorough presentation, and you provided many topics and resources for us to consider. And I think it's very timely. My husband and I were actually talking about this just this week. We have a challenge with family and figuring out how to kind of juggle it with family wanting to visit during the holidays, and how to be polite, and how to figure it out with not hurting feelings. So I definitely appreciate this presentation. So I'm looking forward to some of the questions that we will have from our attendees. So we've received a few, and we do want to hear your other questions. So if you haven't done so already, please go ahead and submit those questions. You can, again, as a reminder, you can use that chat feature or the Q&A through WebEx. And I want to go ahead and start. We have two that are kind of related. One was, I want to look forward to the holidays, but I'm feeling stressed. How can I help my family understand I'm concerned about remaining healthy? And I know you talked about this a little bit earlier on, and someone also asked if you have any advice on how to talk to the grandkids about why I decided not to attend a family gathering.
Yeah, and I know that these are really common and difficult conversations and thoughts popping in our head. And I know you mentioned, thinking about this with your family, and I'm certainly doing the same with my husband and our families. And so we're all in that boat of trying to figure out what makes sense. So in terms of, it sounds like the first question was about having the anxiety of what to do and how to talk about it, right? And then specifically with grandkids for the second question. I think, kind of walking through those steps, if you haven't decided yet what your plan will be, knowing that maybe you're not ready to decide yet, and maybe you need to walk through some of those decision-making tools to help you decide, and maybe it's something where you do make a decision closer to the event. If someone, has decided that they're just not going to be able to participate in the typical gathering that their family is hoping for, and having anxiety about that and how to talk to their family, I think just being, gathering your courage, maybe doing some deep breathing exercises through one of those apps or on your own before having a conversation with a family member, and then even writing out that script or copying down some of the things that I wrote in terms of talking to them about what you've decided. If it is that you really don't feel like you can attend whatever gathering they're planning or come together for the holidays, really walking through some of those bullet points and keeping the focus on you versus them, right? So I've decided this is the best decision for me to keep me safe or to keep everyone safe. I really want to be with our family and have our normal holiday celebration. And I don't feel safe at this time doing it in the typical way. But here's what I was thinking, trying to find a way to still celebrate and look forward to the holidays, like you said, in a way that feels comfortable. So that might be that you find a way to be part of the family gathering for a shorter period of time or in an outdoor setting, and you set your own limits and kind of gently but firmly and sort of neutrally inform those involved that that's the decision you've made and that you really still are looking forward to celebrating it all this year and knowing that, we hope we can have our normal celebration and not worry about all this next year, and that this year it might look different. In terms of talking with grandchildren, that is a great question. And, all of the kids these days certainly do pick up on what's going on, and we hope that they're getting good information at the right developmental level based on their age that can help them make sense of what is happening in our world right now and why, right? Why are people wearing masks? And, the explanation may vary based on the age, but that there are certain things that help keep people safe from getting sick, from getting COVID-19. And that, right now, family gathering is not something that, that we as grandparents are able to come and be part of because, we want to keep everyone healthy, and we know that certain people might worry more about getting sick and might need to be even more careful. And so just really basic terms can help kids understand, and we don't have to shelter them from those basics because they should know that. And it doesn't have to be scary too. So, letting them know that we're going to be safe and careful this year, and we're not going to be able to be there all together, so that we make sure we don't get sick. And that doesn't mean that we can't still celebrate in some way, whether we're, calling in or video chatting in to part of the gathering or sending things or sharing food, that is dropped off without contact. And then getting excited for, the idea that when it's possible, we'll be able to do those things again, and maybe we can have a holiday celebration of some sort, even if it's before the next holiday, but things are better in terms of the virus. So just kind of trying to help kids understand and reframe it in a way that feels, like there's still some positive aspects of it.
Thank you for that. We do have a question if I do get together with my large family, should I tell my dialysis facility? They ask before my dialysis, does family count? It sounds like this question is related to the kind of the screening questions that they ask prior to dialysis. So they're asking if they get together with their family before dialysis, it sounds like.
Okay, so maybe the center is asking them if they are gathering with people outside of their household, it sounds like.
Right, and if family counts for that.
Yeah. You know, I mean, in the strict sense, I think it's probably best to be honest in that if someone in your family does not live in your household, then yes, you might be gathering with people outside of your household. I don't know if, I guess at least here that wouldn't mean that you can't come for dialysis treatment. I think that's a good question to ask them ahead of time even. Like, I'm wondering if I am gathering with some family out of my household, what does that mean for my dialysis treatment? Because, you definitely need to keep getting your dialysis treatment. And if that means that they isolate you in a different room for the week after, that's okay. But I think what would be more concerning would be if you're gathering in a very large group or you're gathering with people who, have the virus or have been exposed to it recently. That would probably be more concerning versus I'm going to, gather with some family and I, know or hope that they're taking precautions and they're not visibly ill and we're all going to take precautions. So I do think that shouldn't mean anything in terms of not being able to get treatment or your healthcare team being mad at you. I do think it's helpful to ask your healthcare team these kinds of questions and be upfront and honest with them and know that I think most healthcare teams tend to tell patients that, again, it's about weighing those risks and benefits and that it's not that there are necessarily absolutes. There might be certain things that they might tell patients who are high risk that they really shouldn't do, but you can engage in a conversation about that and see where that line is.
Thank you again for answering that question, Dr. Christofferson, and for your excellent presentation. We appreciate your expertise and your time on this call today.
Thank you. It's really a pleasure to present to the group.
We appreciate it. And at this time, we would, we received some information that someone is planning on sharing this information with some other information. So thank you for letting us know that. And at this time, we'll go ahead and continue with the next slide. So as we start to conclude this call, we'd like to share a few resources with you. The NCC website also offers a web page with information for patients and family members. The resources available on this web page would be appropriate for someone new to kidney disease, someone who is thinking about changing their treatment option, or learning more about the current treatment option. To access this, you can visit www.esrdncc.org/patient. Next slide. We also have been discussing, obviously, COVID-19 during this call. So we'd like to remind you to visit www.kidneycovidinfocenter.com, and this is a screenshot of that page. And you can view up-to-date COVID-19 patient resources. When you visit, be sure to click the For Patients button to gain access to a variety of resources. Next slide. And Dr. Christofferson shared several reliable resources. The NCC also offers resources for where to find credible information, and this handout lists many resources as well as links, and we recently posted a new video, and both of this information can be found at, you guessed it, www.kidneycovidinfocenter.com, and then be sure to click on the For Patients button. Next slide. Now, it was mentioned to discuss some of your concerns with your care team, and some of those appointments may be occurring virtually. So the Kidney Patients Care, Your Guide to Using Telemedicine, is a toolkit that explains telemedicine. It offers tips to enhance any appointments that you may have, and it also includes a checklist and an appointment tracker. You can find this at kidneycovidinfocenter.com, and again, click on the For Patients button. For our final resource on the next slide, we want to remind everybody about the kidneyhub.org. It is a mobile-friendly web app developed by the NCC with input from our patient subject matter experts. It has information on home dialysis, the kidney transplant process, infection prevention, mental health, and more. I have it saved on my home screen on my iPhone, and it makes it extremely easy to gain access to useful information. So please check it out today if you haven't done so already. And as a reminder, our patient COVID-19 webinar events are now on every other week. So the next patient event is Tuesday, November the 17th at 4 p.m. Eastern, and the next professional COVID-19 call is next Wednesday, November the 11th at 3 p.m. Eastern Time. Thank you all again for being with us this afternoon. For additional COVID-19 resources, you can also visit the CASER website at casercoalition.com. We thank you for joining us, and we hope you have a good evening. Take care.